Professor Manuel Franco, Spain is in a state of emergency for a month due to coronavirus. Your experts have warned of a complete collapse of the health system. What is the current situation?
Well, right now we are in the entering the fourth, or in the middle of the fourth week of confinement, after the emergency state was declared by the government. I would not say that right now the health system is collapsed. I don't think that it has ever been totally collapsed. Truth is actually that right now probably the crisis or the pandemic or the epidemic right now in Spain is starting to plateau. So I think the most important question right now is how do we continue controlling the situation, and how can we go back to not everybody, but some people in our society in Spain will come back to work gradually, and how can we do this without coming back to previous numbers?
What is the most affected group of citizens, and how much does social inequality in Spain contribute to spreading the virus?
Well, that's a very important question, Lipa. I don't know the situation in Macedonia, but here, but also in you are listening to the news, and you are listening to the data in other countries, in the UK or in the USA. What we are seeing is that peoples in different socioeconomic status or social classes are getting infected at different rates. So we need to pay attention all the time to who is in more need for protection, who is in more need for care, who is in more need for being tested. What happened in the United States, and we have been able to measure that, is that people in the higher income of society are getting tested, while the people in the low income are not getting tested at the same pace. So that's a problem, because actually people in the low income neighborhoods are the ones that need it the most.
Spain stays in quarantine until April 26, I think. Then what?
Well, that's the 1 million or the many million question right now. So the state of emergency has been declared till April 26th. Now we need to see how can we come back to more activities. Only strictly essential jobs have been working. Now, starting Monday and Tuesday, more non-essential works or jobs will be starting to fill. So this is a decision that I think is necessary at some point. So what we need to bear in mind is to keep very tight the control on the monitoring of the cases and the number of people in the ICUs, in the critical care units, and the number of deaths, that we control them. As you know, the virus, one thing is to get infected, one thing is to get people into hospitals. So there's a lag of 2-3 weeks between you get infected and then you get people to be really sick. So we need to bear in mind and have a very close monitoring of what's going on with this 2-3 weeks period.
Why is there such a big difference in the percentage of deaths in different countries?
It's a very difficult question. It depends on things like when did we start with the confinement? When did we start with the first cases? How did we identify and isolate those first cases? Then we need to bear in mind also what happens in large cities. You know, what we're seeing in cities like Madrid, Barcelona, New York is very similar. So the patterns are not so much about specific countries. It's about specific situations on when did we take care or did take specific steps to control the epidemic, and how do we do it in large populations, like, for example, big cities like Madrid.
Will this crisis end with the creation of collective immunity?
Right. So well, one thing that we know for sure is that this pandemic will start to fade worldwide, not just in Spain or in Macedonia or in Central Europe or in Asia. This pandemic will rotate from different countries to countries, and the only way that we will be able to control it is by having a certain level of what we call herd immunity. And that can only happen given two possibilities. One is that we develop the vaccine, and the second one is that a large amount of our population gets infected, so gets the virus without any consequences. So that takes time for both steps. One, to develop the vaccine, because it takes years to develop the vaccine, not just to develop the actual drug or the actual treatment, is to develop the whole system of how do we produce it, how do we distribute it, and how do we bring it to the population. So both steps are gonna need time. So that means that we never necessarily will continue to have certain amount of measures of what we call social distancing or physical distancing between people to stop the contagion chain.
Professor Franco, what is your message to your Macedonian colleagues and authorities?
Well, I think our main message is social distancing is a very important measure that we have to take once the epidemic takes what we call community epidemic, which is we cannot control anymore who is infected, who is not. Another important advice is you should be trying to have so many people as possible monitoring this epidemic. If you are able to test large amounts of population, that's also an important piece. So on the other side, I think that politically, what we see is that we need to be united in front of this pandemic, instead of disagreeing between parties in the different within the same country. That's another important advice